Hello friends, my name is Sajjad Pathan and I welcome you all once again to another video for the MRCEM or FRCEM primary exam as we call it. Good luck for those of you who are going to appear for the exam this month, and today we shall look at some tips how to appear for this exam and how to prepare for it. Maybe I'll add on some mnemonics which you guys must have seen previously, but just to reinforce the fact once again we'll go over it. So without wasting any further time, what we'll do is we'll start with question number 1 over here. So the question states, 36-year-old woman is in the emergency department with right ankle pain and inability to walk. 30 minutes ago, while playing tennis, she felt as if someone had kicked behind the ankle. She has no comorbidities except she was treated for a recurrent UTI 2 weeks ago. On local examination, she is unable to plantarflex her right ankle and the Simmons-Thompson test is positive. What could be responsible for her presentation? Is it traumatic injury to the anterior talofibular ligament? We all know that the anterior talofibular ligament is the weakest part on the lateral ankle and that can get strained very easily. Use of performance enhancer steroids, nitrofurantoin use, DNA topoisomerase inhibitor use, HMG-CoA reductase inhibitor use. So we'll pause over here for 10 seconds and then you guys can think about the answer and we will move on from there. Okay, so you guys must have thought about the answer. Now in this slide what you see is the Simmons-Thompson test. If you look at the picture given on the top, it shows clearly that one of the ankle is flattened out on the left side, and that is the, I'm sorry about the light coming on the face, flattened out on the left side, and that is the Achilles tendon tear, Achilles tendon rupture, and it is tested by the Simmons test, the Simmons-Thompson test. It's also called as a squeeze test. When you squeeze the cuff, nothing happens. So the explanation given over here is Achilles tendon rupture. Always think of quinolones, local steroid injections, trauma and old age. Statins are HMG-CoA reductase inhibitors. And they can cause tendinopathy. Some cases of tendon rupture have been reported as well. Quinolones, commonly used for UTI. The scenario clearly described that she has been treated for a recurrent UTI. So that means she must be on a long-term quinolone, likely for 2 weeks or so. And quinolones are number 1 cause of rupture of the Achilles tendon. It inhibits DNA topoisomerase 2 and 4. So that is the right answer, which was the option number 4. Nitrofurantoin does not cause tendon rupture. Nitrofurantoin is implicated in lung fibrosis cases. So remember, from this scenario, tendon rupture, positive squeeze test, surgical treatment, equinus cast, and the pearl over here is the ankle is stable in dorsiflexion. So all those people who wear high heels, please stop wearing them, because you twist the ankle at that point, there is likelihood of you getting an injury or a serious injury leading to operative repair. Let us not waste further time and look at question number 2. The 17-year-old male is in the emergency department because of severe left knee pain for an hour. He was playing football when an opposing player hit the lateral aspect of the knee. He was unable to finish the game because of pain and he feels instability in his knee. Examination of the knee shows a large effusion. There is tenderness along the medial joint line and Lachman test is positive. Which of the following structures were most likely damaged? So there are 5 options given over here. You guys can read it. Anterior cruciate ligament, lateral collateral ligament, posterior cruciate ligament, anterior cruciate ligament, medial collateral ligament, meniscus, anterior cruciate ligament, medial collateral ligament, posterior cruciate ligament, anterior cruciate ligament, medial meniscus, posterior cruciate ligament, medial collateral ligament, lateral collateral ligament, and posterior cruciate ligament. So we'll pause over here for 10 seconds and then we'll move on to see the explanation. The scenario is describing here the unhappy triad. The unhappy triad is your anterior cruciate, medial collateral and the meniscus injury. So it is AMM, anterior cruciate, medial collateral and meniscus injury. It could be medial meniscus, it could be lateral meniscus. There is no posterior cruciate, there is no lateral collateral, okay? The importance of this is it's very easily rupturable, these three parts, and needs surgical treatment because it leads to an unstable knee joint. I'll take a moment over here to explain to you how do you examine a major joint. I'm giving an example of knee over here. So whenever you're doing an examination of the knee joint, you do the look, feel, move, active and passive movement, and then what you do is you do some special test. You can do varus test, valgus test, and the anterior drawer, posterior drawer, and the Latchman test. These will show the stability of various ligaments around the knee joint. After you've done this, what you're going to do is you're going to examine the joint above with look, feel, move, and examine joint below look, feel, move. Then you'll do a distal neurovascular assessment. So always remember, whenever you're doing this major joint examination, you need to know this. There's a very nice video given by Geeky Medics. I'll put in the link below. You can have a look at that one. Let's move on to question number 3. 25-year-old male is in the emergency department with lower back pain radiating to the leg for 2 days. He is a road construction worker and states that pain develops suddenly while he was lifting a heavy bag of concrete. Medical history is unremarkable. Examination shows a diminished ankle jerk on the right. A diagnosis of disc herniation is suspected. Which nerve root is likely affected? Options are L2, L3, L4, L5, S1. So we'll take 10-second pause and think about the answer. So guys who have watched my previous videos of the reflexes, you guys must have heard about this nursery rhyme: 1, 2, buckle my shoe, 3, 4, kick the door, 5, stick, pick up sticks, 7, 8, lay them straight. So remember, you tie your buckle of the shoe at the ankle, right? So that's your 1, 2, S1, S2, buckle my shoe. 3, 4, kick the door is your knee reflex, L3, L4 is the knee reflex, 5, 6, pick up sticks is your biceps and brachioradialis reflex, C5, C6, 7, 8, lay them straight is your tricep reflex. So that's easy. Well, before we move on to question number 4, I want to take some time for you to describe the lumbosacral plexus, because this can be put up in various ways. What I'm going to do is, as I'm doing it, I want you also to take a piece of paper and start doing what I'm doing. So I'm drawing T12, L1, L2, L3, L4, L5, S1, S2, S3. Okay, is it clear? If it's not clear, I'm vocalizing it so you guys can see it. Just put in your comments if it's not very clear. I will try to take a picture of this and put it across at the end. So I draw one line from T12 and I join L1. This is your ilioinguinal and iliohypogastric. Then I draw a line L1 and I join here. This is your genitofemoral nerve. Then I draw a line and I join here. This is your lateral cutaneous nerve of the thigh. Now what I'm going to do is, I'm going to take L2, L3 and L4 on both sides. This is your obturator nerve and this is your femoral nerve. Okay, I'll take L4, 5, S1, S2, S3 together and make your sciatic nerve. The obturator nerve divides into anterior, posterior and cutaneous branches. The anterior lies between abductor longus and brevis, and posterior lies between abductor brevis and magnus. Abductor magnus, abductor brevis, and abductor longus. The order is, I don't remember the order clearly, but these are the abductors, the magnus, brevis, and longus, and the cutaneous branch. So, if you want to remember what is the muscle this nerve supplies, it's your abductor longus magnus brevis and supplies cutaneous. Name is obturator, so obturator externus, not the internus. Yeah. The femoral nerve goes through the adductor canal, which is below the sartorius, and becomes superficial after that, and gives a branch called saphenous. Saphenous nerve on the medial aspect of the ankle. Yeah. The sciatic nerve goes to the popliteal fossa and divides into tibial and common peroneal nerve. The common peroneal nerve will become your superficial peroneal nerve and deep peroneal nerve. The tibial will become your posterior tibial nerve and will give some branches to your sural nerve. Sural can come from both. The question over here is, your common peroneal nerve can be injured if you are put in a below knee cast. Common peroneal nerve can be injured and you can get a foot drop. The other question is your deep peroneal nerve. Deep peroneal nerve supplies the first web space. So these are the two questions that might be asked. And if somebody says, okay, what are the nerves you have to block the ankle? What are the nerves you have to block the ankle? It is your deep peroneal, superficial peroneal, sural, posterior tibial, and the saphenous. So 5 nerves to block the ankle. Okay. Now let us move on to question number 4. A 2-year-old girl is in the emergency department because of immobility of her left arm for 3 hours. She expresses pain at any attempts to move it. Patient is sitting in her father's lap in no acute distress, holding her left arm and slightly flexed across her belly. So like this or like this. Which of the following explains the patient's condition? Slippage of annular ligament, misplaced inner epicondyle in the elbow, ulnar nerve injury, lower trunk of brachial plexus, upper trunk of brachial plexus. Take a pause for 10 seconds and we'll see the answer. So the diagnosis over here is a 2-year-old. Classically, it's a pulled elbow, or called as nursemaid's elbow, right? So diagnosis is nursemaid's elbow or pulled elbow, which is because of the pulling of the radial head out of the annular ligament. So it slips out of the annular ligament, and it's very classically seen in these young kids. The upper trunk injury can lead to Erb's palsy, which will give rise to porter's tip hand. Erb's palsy. The lower trunk will give rise to Klumpke's palsy, which will give rise to the claw hand. Yeah, claw hand. The ulnar nerve injury in itself can give rise to ulnar claw, and the inner epicondyle, the ossification center, is unlikely to appear at this age group. If you remember your cretol, it's capitulum, radial head, inner epicondyle, trochlea, olecranon, external epicondyle. Yeah, or lateral epicondyle. So cretol, and it happens at 1, 3, 5, 7, 9, 11, these age group. So inner epicondyle to be misplaced doesn't fit into this age group. If it was a 5-year-old, possibly yes. So this image shows the Erb's palsy and Klumpke's palsy. Erb's is upper trunk, C5, C6. Klumpke's is lower trunk, that's your C8 and T1. Okay, Erb's can happen during delivery or fall. Klumpke's can happen when somebody is falling off a tree and holds onto a branch, so it's like hyperextension, so that kind of thing. Let us now see question number 5. 32-year-old male is in the emergency department with fever and swelling on his right knee. He denies any comorbidities or trauma. The pain is so severe that he is unable to bend his knee anymore. Examination reveals warm, red, extremely tender right knee with no active or passive range of motion. He is sexually active with a single partner for years. A diagnosis of septic arthritis was considered and a joint aspiration was considered here. And what they aspirated was a thick yellow fluid about 50 ml. What is the most likely finding associated in this scenario? Purple stained rounded organisms in cluster, purple stained rounded organisms in chain, red stained rounded organisms in cluster, red chain diplococci with a capsule, purple stained diplococci. So let's take 10-second pause and select our answer. So remember one thing, they have indirectly asked what is the most likely cause of this presentation. So as we all know, this is septic arthritis, and the most common cause of septic arthritis is your Staphylococcus aureus. Staphylococcus aureus is a gram positive in clusters. So clusters, there are only 2 examples, so let us get the 3 out. So purple stained and red stained. Another hint I'll give you, gram positives are purple. P for purple, P for positive. And pink or red is negative. Red is negative, right? A negative light, traffic light red says stop and danger. So red is negative. So our answer over here will be purple stained rounded organism. But can it be gonococcal? Neisseria gonorrhea is also one of the cause of septic arthritis, especially in a reproductive age group patient. But this man is sexually active with a single partner for years. So it's very unlikely that this is gonococcal. Moreover, gonococcal arthritis will give rise to some hyperpigmented patches, migratory arthritis, it is there. It's called as dermatitis arthritis syndrome. So it's very unlikely to be gonococcal, but you need to keep that in mind. Gram positives in cluster, Staphylococcus aureus. Gram positive in chain, Streptococcus. Gram positive diplococci, purple diplococci is strep pneumonia. Okay. Gram negative cocci, diplococci. Gram negative cocci is diplococci is Neisseria and Moraxella. Neisseria gonorrhea and Neisseria meningitidis, we have to differentiate the 2. One will have a capsule, one will not have a capsule. So how we differentiate is go no, so there is no in gonorrhea. Okay, so they do not use condoms, so they get sexually active disease. Yes, they do not have a capsule. Meningitidis will have a capsule, okay, and it affects the brains. Before we end this, let us look at few mnemonics and revise them again. So C3, C4, C5 keeps your diaphragm alive. That is your diaphragm, the innervation of your diaphragm, which is your phrenic nerve. Okay, C3, C4, C5 keeps your diaphragm alive. Now the question over here is, what are the openings of diaphragm? It's Voice of America, right? Voice of America. Let us make it much more easier. It is Voice of Abu Dhabi. V for vena cava, O for esophagus, and Abu is aorta and Dhabi is the duct, which is azygous duct. Okay, so 8, T8, T10, T12. C5, C6, C7 raises your arm to the heaven. So it does this, which is your serratus anterior, nerve to serratus anterior. If the nerve to serratus anterior is injured, what you get is winging of scapula. Okay, sternocleidomastoid and trapezius. These 2 nerves are innervated by the accessory cranial nerve. Okay, the dermatomes you need to remember. C5 is where you got your corona jab. C6, after you got the jab, you took a selfie. Those who didn't take it, C7, C8, T1, T2 is your nipple, T6 is your xiphisternum, T10 is your umbilicus, T12 is your pubic symphysis, L1 is your ligament inguinal, and then so on and so forth. Remember, we stand on S1, we kneel on L3, and we sit on S3. Okay. Let us look at rotator cuff muscles. It is sits, right? The head of humerus sits in the glenoid cavity. The seat is not really good, therefore it dislocates. So it has to be supported by the sits muscle, supraspinatus. Supraspinatus, what it does is, it does this 15 degrees of abduction, supraspinatus. Infraspinatus and teres minor is doing this external rotation, and subscapularis is doing internal rotation. Supraspinatus, infraspinatus, teres minor, subscapularis. Okay. Supraspinatus and infraspinatus supplied by suprascapular nerve, teres minor supplied by axillary nerve, and subscapularis is by nerve to subscapularis. Carpal tunnel syndrome will compress the median nerve. The median nerve is found between flexor carpi radialis and palmaris longus. Okay, median nerve is found between palmaris longus and flexor carpi radialis. The carpal tunnel is there, below which the median nerve goes, and it can lead to entrapment in hypothyroidism, pregnancy, fluid overload state, or obese patients. You test it by Tinel's test. Yeah. The median nerve supplies loaf muscles in the thenar eminences. Sensory supply is 3.5 digit. Loaf muscles are lateral lumbricals, opponens pollicis, abductor pollicis brevis, and flexor pollicis brevis. Okay. There is another canal over here called as Guyon's canal, through which goes the ulnar nerve, and you can get Guyon's canal syndrome or ulnar nerve syndrome. Okay. Anatomical snuff box, the boundaries are radially towards the radial side, or you can call it proximally, it's your abductor pollicis longus, APL. In my video I have told you APL. On the ulnar aspect it is EPL, extensor pollicis longus. So APL, EPL, APL, EPL, APL, EPL. But APL doesn't like to be alone, so it is with EPB as well. So extensor pollicis brevis is with APL. The floor is formed by the scaphoid, which contains posterior intraosseous nerve, which is a branch of radial nerve, and posterior intraosseous artery, which is a branch of radial artery. Anterior intraosseous nerve is a branch of median nerve. Anterior intraosseous artery is a branch of ulnar artery. Radial nerve supplies the beast muscles. Beast. Okay. Biceps, brachioradialis, all the extensors of the hand, forearm, and arm. Supinator. A for Anconius, supinator, and triceps. Okay, so beast. Lumbricals, the function of lumbricals is to flex your fingers. So it flexes the metacarpophalangeal joint and extends the interphalangeal joints. Okay, it makes your hand looks like a L or a snake. Lumbricals, L for lumbricals. Marmu are the nerves of the brachial plexus. Musculocutaneous, axillary, radial, median, ulnar. Femoral and obturator nerve is L234. Let me take a little look at Virchow's triad. The three components of Virchow's triad are endothelial injury, stasis of blood vessels, and hypercoagulability. These three factors can lead to formation of clots in the body, especially in the lower legs, and it can give rise to DVT. Okay. Well, that's all for now in this video. If you need something else to be made up, I can make another video. Put in your comments below, and thank you from my heart for watching this video till the end. But remember, the physiology is stated by Frank Starling. Yes, the cardiac output or contractility is completely dependent on the preload. So like, share, and subscribe to this channel. Spread this video worldwide. The amount of love I will get, maximum output I will make. Okay, good luck for your exams. Stay safe, stay healthy, and peace.